Right now, somewhere in a hospital, a surgeon is cutting open a human body under bright lights, with sterile tools, with a team trained for a decade standing beside them. The patient is unconscious. They feel nothing. They will almost certainly survive. This has been normal for about 150 years. For the 300,000 years before that, none of it existed. No anesthesia, no antibiotics, no germ theory, no understanding of infection at all. And yet here you are. Every single one of your ancestors made it through. Not one of them died before they reproduced. Not one of them was taken out by something a modern doctor could have fixed in an afternoon. So the question is not how primitive medicine was. The question is how humans actually survived long enough to build the world that made modern medicine possible. The answer is stranger and more sophisticated than anyone gives it credit for. Start with the thing everyone gets wrong. Past childhood was, by most measurable standards, physically healthier than the average person alive today. Better cardiovascular health, stronger bones, less chronic disease, fewer metabolic disorders. This is not romanticizing the past. This is what the skeletal evidence actually shows. The danger was not chronic illness. The danger was acute crisis, infection, injury, childbirth, famine. And for those crises, humans built systems that worked well enough to keep the species alive for hundreds of thousands of years. The first system was the body itself. Your immune system is not a modern invention. It is an ancient war machine refined over millions of years of contact with every pathogen this planet has ever produced. Before the first human ever picked up a herb or mixed a poultice, the body was already running a defense operation of staggering complexity. Fever is not a malfunction. It is a deliberate weapon. Your body raising its internal temperature to a point where bacteria struggle to replicate. Inflammation is not damage. It is a controlled response, flooding a wound site with resources to contain a threat. The clotting cascade that seals a cut happens in seconds and involves over a dozen proteins working in sequence. None of this required a physician. It required 3 billion years of evolution, and it was already there. But the body has limits, and when those limits were reached, humans reached for something else. Plants. Long before any written record existed, humans had accumulated a pharmacopoeia that modern science is still working its way through. Willow bark contains salicin, the compound that would eventually become aspirin. Humans were chewing it for pain and fever thousands of years before anyone understood why it worked. Opium from the poppy plant was being used as a painkiller in Mesopotamia at least 5,000 years ago. The Ebers Papyrus, an Egyptian medical document from roughly 1550 BC, lists over 700 plant-based remedies. Honey was used to dress wounds across dozens of unconnected cultures on every inhabited continent, and we now know why. Honey is hygroscopic, meaning it pulls moisture out of a wound, starving bacteria. It also produces small amounts of hydrogen peroxide. It is a functional antibiotic that grows on flowers. Ancient healers did not know any of that chemistry, they just knew it worked. And that empirical knowledge accumulated across thousands of generations, passed from healer to apprentice, was the first medical database in human history. What made it powerful was not individual genius, it was collective memory. In every human society ever studied, there has been a specialist, a person whose role was to hold the medical knowledge of the group. Shaman, herbalist, midwife, medicine man, wise woman. The names change, the function does not. This person spent a lifetime learning which plants healed and which ones killed, which wounds could be treated and which ones meant death, when to intervene and when to let the body work. They were not guessing. They were operating from a body of knowledge built over generations, tested by survival and refined by failure. The ones who got it wrong did not pass on their methods. The ones who got it right became the foundation of the next generation's knowledge. It was medicine run on evolutionary logic, and it went further than plants. Surgical intervention is not a modern idea. Trepanation, the practice of drilling or scraping a hole in the human skull, is the oldest surgical procedure with confirmed physical evidence. Skulls with trepanation holes have been found on every inhabited continent, some dating back over 7,000 years. The detail that stops most people cold is this: many of those skulls show bone regrowth around the hole. The patients survived. They did not just survive the initial procedure, they lived long enough afterward for their bone tissue to heal and grow back. Someone was performing brain surgery 7 millennia ago, and their patients were walking out alive. Amputation, wound cauterization, the lancing of infected tissue, all of it practiced in the ancient world, all of it documented in physical remains or written records. Roman military physicians were setting broken bones and performing field surgery at a level that would not be surpassed in the Western world for over 1,000 years. Ayurvedic medicine in India was describing surgical instruments and procedures in texts that predate the Roman Empire. The Islamic Golden Age produced physicians like Ibn Sina, whose medical encyclopedia remained the standard reference in European universities until the 1600s. The knowledge was there. It was sophisticated. It was being built continuously. But here is the part that rarely makes it into the story. A significant portion of pre-modern survival had nothing to do with treatment. It had to do with structure. The way communities organized themselves was, in many cases, a medical intervention in itself. Mosaic law prohibited the consumption of certain animals, the mixing of specific foods, and mandated washing rituals that we now understand as contamination control. It was not framed as hygiene. It was framed as religious obligation. The outcome was the same. Islamic tradition prescribed specific protocols around the handling of the dead, the preparation of food, the use of water. These were not understood as public health measures.
Childbirth is where the fragility of pre-modern medicine shows most clearly. Maternal and infant mortality was real, significant, and remains so until surprisingly recently. But even here, the picture is more complex than simple helplessness. Midwifery traditions around the world had developed evidence-based practices over centuries, specific positioning techniques to reduce tearing, herbal preparations to manage hemorrhage, protocols for difficult presentations, the knowledge that a prolonged labor without progress was a crisis requiring intervention. These were not instincts. They were skills accumulated and transmitted across generations of women who had stood in those rooms and watched what worked and what didn't. What ultimately limited pre-modern medicine was not lack of intelligence or lack of care. It was the absence of one specific idea, germ theory. The understanding that invisible living organisms could enter the body and cause disease did not exist until the second half of the 19th century. Every medical tradition in history was operating without it. You could identify that something caused disease without knowing why. You could treat symptoms with genuine effectiveness. You could perform surgery and set bones and manage chronic conditions. But you could not stop a surgeon from killing a patient with his unwashed hands because no one yet understood that his hands were the weapon.
When Louis Pasteur and Robert Koch established germ theory in the 1860s and 1870s, they did not invalidate everything that came before. And with that single conceptual breakthrough, everything accelerated. Antiseptic technique, vaccination, antibiotics. The entire architecture of modern medicine was built in roughly 150 years. Modern medicine did not teach humans to care for each other. It just gave them better tools. Thanks for watching. If you enjoyed this journey through the history of medicine, don't forget to like, subscribe, and join us for more fascinating videos.